question is, the LNP has announced policy on maternal and child health service, i.e. 6 free nurse consultations at home after birth of baby. Given the shortage of nurses and midwives, where will the LNP find the nurses and midwives to fill these roles, and why is it planned to outsource these new services to the private sector rather than expand upon the excellent existing Queensland health services in this area? But I'd just like to make an adage. I'm from the electorate of Gregory, and last week's paper, Cameron Newman has announced that he is publicly committed to re-establishing a maternal and child health service. This service will provide home visits for 2 to 4 weeks of age and free consultations at the community centres at 2, 4, 8 and 12 months for all mums and new babies. We have never not had a maternal and child health service. It's now called Child and Family Service. It's run from the community health building located in the hospital grounds. We do all range of services. We are short-staffed. We don't have enough cars, but we do the whole outreach to the whole Central Highlands community.
Thank you, Judy. Thank you.
Everybody's paper.
With your indulgence, gentlemen, I will get Mark to respond first. My question to the other panellists, though, on the same issue, is that do you have any plans for maternal and child health service improvements? So I'll let the Shadow Minister respond first, and then I'll hand over to everyone else.
Can I just outline a little bit about the policy? I'm not aware of the particular article, but I think it referred to a statewide initiative, not just in relation to the situation in Gregory. The idea behind the policy is quite clear: to provide the assistance and, if need be, direction to young mums with very young children. We see this as part of the preventative measure that Adam was talking about, and that if we get young mums and young bubs and we get them to talk to a clinical nurse, male or female, on maternal and child welfare issues, we get the start in the family that we've been looking for so long, so that when they go at 2 weeks, 4 weeks, 2 months, 4 months, 8 months and 12 months, either to a visit to their home or to a centre for 45 to 60 minutes, they get the advice they may need on either maternal or child welfare issues arranged across a number of initiatives. In addition to that, what the policy does is if they don't able or can't get the information from the clinical nurse, they then directed to other people within the community that can help them. So we're putting in place a preventative measure early on so that maybe we can start addressing the issues that are chronic as time goes by and not waiting until it is too late. Will it be a challenge? Yes, it is. But this is where I think we can start developing new initiatives for nurses to move into new areas as well. We can bring back the nurses who have left the system by providing them with a new career path. We can actually get younger nurses moving through, and here is another new career path they can start following. So what we're trying to do is develop a system for mums and bubs, and also bring nurses who have left the system back in with a new career path and direct the new cohort, and there are a lot of cohorts, a lot of nurses coming through the system, into a new stream. And this is what we're trying to do by developing a mums and bubs policy. So it's across the spectrum. Now, the article you referred to, and I apologise, I think it refers to the statewide initiative, not in relation to Gregory itself.
Thank you. Thank you for that. Adam.
I want to say, as a midwife, we do that already. We do that. That's in place. That policy's there already. We do that.
Thanks, Karen. That's good. Thank you. Adam.
So what was the version of the question?
Well, I was just wondering. It's along. Yeah. Have you got any? Has your party got any plans for maternal child health service improvements?
Yeah, our policy specifically talks about not only recruiting more midwives, but also particularly trying to make them increase their availability in rural and regional areas. And it talks about measures such as ensuring there's greater access to clinical rooms attached to community health centres and those kind of things in those areas that are underserviced.
Thank you. Minister.
The policy that my colleague has just described, the Bligh government went to the 2009 election undertaking to do that. When we were re-elected, we went ahead and did it. And so that now across 18 centres in Queensland, as well as major public hospitals and community health centres, on an outreach basis as described in Gregory, approximately 90% of birthing mothers have, in the last 12 months I believe, if I've got my figures correct, have received a home visit, one or more home visits after the birth of their child. There is no cap in the way in which our program works on the number of home visits that that may be available, or visits into the community health centre, or to the hospital, or to the community health hub. No limit at all. The funding is not capped. The funding is provided to provide the service. The service is driven by the demand of birthing mothers. It started low in 2009, 2010, but we've ramped it up, and as I say, it's about 90% now, and we'll continue to drive that throughout the state. So it's a policy that was announced before the last election. With the election of the Bligh government at that time, we then went ahead and implemented it. We've implemented it, and we're continuing to roll it out and to penetrate so that more and more mums get access to this. It's uncapped as to frequency, and it's uncapped as to funding.
Thank you. Aidan?
Yeah, thanks, Judy. In relation to the concern you had about outsourcing it to the private sector, can you just read that part again? Was there a concern about that? Was that raised in the article?
Why is it planned to outsource the services to the private sector rather than expand on the existing Queensland Post?
Yeah, no, I'd be certainly against going into the private sector, because I mean, undoubtedly that'll just be a charged service in time. Absolutely, they'll look at their bottom line, and it'll be a big gap between the haves and have-nots who can afford it. So I certainly would be against even entertaining the thought or even going down that path. I think from what you've said is that you've just got to build into the existing structure. And if we have a political leader out there espousing his own policy, then it's one of those very rare moments where it sounds like to me that there's tripartisan support for something that already exists.
Thank you.
Point of clarification, if I may.
Yeah.
What I said before is delivered by publicly employed nurses and midwives in our public health system, and that's where it'll remain.
Thank you.